Hello, good morning. It's Jenny back from here in her hillbilly state. There was the Empress, anyhow. Hillbilly state here in the middle of Nowheresville, America. What you just saw there was the Empress. She was supervising the snowflakes are falling. We are due to have some sort of a really major snowfall here, and she was just making sure that the snow was falling correctly, doing her supervisory skills that she can do as a cat. In fact, I believe that I am going to go out on a limb and say, just as a nurse, I think her supervisory skills were far, far superior to any of the supervisory skills that the consultants did with the trainees at the Countess of Chester Hospital. In fact, I even believe that her feline IQ was even much greater than even any of the trainees to begin with, to tell you the truth, and definitely the consultants. However, definitely she definitely did agree with me that she thought that Lucy's cats were far superior to her. So at least I got her to agree to something. Now, basically, this is part 3 on Baby E. I'll just let you look at my previous 2 videos to kind of get a background on this poor baby. And basically, the downfall of this baby was the fact that he had, as the consultant during the day, John Gibbs, and in the evening, Harkness, and basically we will find out in other subsequent videos that the combination of these two, I'm not going to call them gentlemen, these 2 bastards, was lethal to many a baby. And even to make matters even worse, ZA was the consultant at the resuscitation, and actually she basically what she did was she was the one that conned the family not in having a post-mortem. So what I'm going to do is I'm going to read to you from the information that was passed on to us in that leaked document. We believe it's probably someone from Thirlwall. So there is good coming out of Thirlwall, to tell you the truth. There are some people there with a conscience. People that, maybe because there's some people that are not knitters, unlike, Lady Thirlwall. So here's what the consultants sent over to Operation Hummingbird. Basically, they said, Baby E was a 29-week gestation twin, died on day 7, blood stain and bile stain aspirates prior to cardiorespiratory arrest. No post-mortem agreed with coroner. Well, and the reason the coroner officer agreed that no post-mortem was needed is because she basically told him she thought the baby died of neck, and gave him the information that the coroner's officer would need to make that decision. And in that coroner's officer's heart, probably believed it was the best thing. She probably done, the family just doesn't want a post-mortem, and this is a premature baby. And basically she was to cover her dumbass and absolutely inferior ability to even think of herself as a physician, and to just cover for herself. Just an FYI, what makes me very angry about this so-called woman, and I'm not going to call her a woman, she doesn't deserve it, because no woman would have treated a baby this way. She was the one that basically, due to her absolute and utter incompetence, allowed a toddler by the name of Ollie to die during the COVID pandemic, and used COVID as a freaking excuse. Absolute poor excuse. There was no excuse for this kid to have died. Even the ambulance drivers that brought the kid in told them that this kid is sick. She didn't even bother to let that kid stay overnight. She didn't even bother to do something as simple as a rapid test for strep throat, and didn't even bother giving it just basically some simple penicillin. Keep it overnight, make sure it's tolerating its antibiotic, and then send the poor little sweetheart home. That little boy is my grandson's age, or would have been my grandson's age had he survived. So that was the excuse she had, because she was undergoing, I guess at that time there was some sort of an inquest going on with this. that she was granted anonymity. So okay, so basically it's a bullshit thing that they sent over to Operation Hummingbird, and they couldn't believe that. It's just the abdominal X-ray taken less than 1 hour before the death showed no signs of necrotizing enterocolitis. Well, then why did you freaking tell the coroner's officer? Except just to cover for your incompetency, and therefore clinically it would not have been anticipated that this baby would have deteriorated and died in such a short time frame. Now I'm going to also read to you the brilliance of, and I'm using that in quotation, of Dowie Evans, as he partaked his utter brilliance, and they just drank from the Kool-Aid of Dowie Evans at Operation Hummingbird. Now, just as an FYI, just a little bit more background on me. During the summer months while I was a student nurse, to earn some cash, I basically worked as a student nurse in the psychiatric unit. So I do have psychiatric background in me. And basically what I would have done had I encountered Dowie at any point, I would have basically gone to my supervisor and asked her, did Dowie's wife give him his morning medication? I think he missed his morning Haldol or whatever antipsychotic he would have required. So I'm thinking what our issues is with a Dowie is that maybe someone is either he is missing his doses of medication in the morning, or maybe he just is not being prescribed the adequate dosage. So anyhow, this is what he's saying about baby E. And basically he's saying, August 2nd, increased risk of neck on the 3rd of August, bile stain aspirates, hemorrhage, 01 a.m. it died, no abdominal distension. Well, ding dong, Dowie. Any severe GI bleed patient I encountered, now granted I did not encounter a neonate with a severe bleed, but I encountered enough adults to note that you're losing fluid, you're losing a lot of important things, so therefore the chances of you having abdominal distension is quite low. So, and he goes, fresh blood from hemorrhage and stomach, no explanation. Well, ding dong, the kid is bleeding out profusely, massively. There would be blood in the abdomen. Now, I am not going to read to you the witness statement of Harkness. It was utterly disgusting. What I'm going to read to you is basically part of the trial transcript. It's just to show you what an absolute bastard this man was. Or I should say is. I don't think he's changed his tune. Unless for some reason he's maybe taken to heart and is speaking to the Crown Prosecuting Services, or at least someone. And maybe his conscience has hopefully gotten the better of him. I so doubt it. So anyhow, here is cross-examination by Ben Myers. And Ben Myers, actually, he did say a lot of he posed a lot of good questions to some of these people and stuff. So, especially in regard to baby E, and he says, Ben Myers says to him, he says, I would suggest you were out of your depth at this point. And of course, Harkness responds, I disagree. He then adds, it is wrong and disrespectful to my ability. Well, what ability did you have there as a fourth-year trainee? I would say 0, if not negative. And just as an added bonus to all you wonderful people who are posting wonderful comments, I got a hold of some unforeseen footage, just like Netflix got a hold of unforeseen footage, and they're going to show you in early February. Well, I am going to put in the description box my unseen footage for you. And basically, I am going to prove to you that Detective Paul Hughes was actually a child musical prodigy. And that prosecutor, Nick Johnson, on the side owns a gas station. And not only that, but he is one fancy, dancy dancer. Man, his footwork is so good. And if I want you to pay close attention to this footage, because you'll see a very quick glimpse of Liz Hall as she's looking out the window and paying close attention to the fancy footwork and utterly admiring Nick Johnson for his incredibly fancy footwork. So again, if you would please watch that footage for me, I would appreciate it, because again, this is the world premiere for it. Bye-bye.